So now we have to discuss about the topic errors in prescription, that is the mistakes which may be occurs in the prescription. Then in the topic errors in prescription we have to discuss two subtopics, that is first one is types of prescription errors and second one is sources of prescription errors. Then first we have to start with types of prescription errors. Prescription errors may cause inconvenience to both patients and pharmacists. There are two types of prescription errors. First one is errors of omission and second one is errors of commission. Then first one, errors of omission. These are the errors which may be occur due to incomplete information in prescription. Pharmacists can overcome these errors by consulting the prescriber. For example, absence of dose, absence of dosage regimen or strength of drug, absence of treatment duration. Then next one is the errors of commission. These are the errors which may be occur due to incorrect information prescribed in the prescription. It is somewhat difficulty to identify than the omission errors. For example, incorrect dose or dosage form, incorrect dosage regimen or strength of drug, duplicate therapy, drug interactions, contraindicated therapy. Then next one, sources of prescription errors. There are 8 subtopics under this sources of prescription errors. First one is abbreviations, second name of medicine, third strength of preparation, fourth dose of drug, fifth dosage form of drug, then instructions to the patient, then drug incompatibility, then other errors. Then first one, abbreviations. While using abbreviation, there may be problems in understanding and dispensing the medicines. If there is any doubt, a pharmacist shouldn't guess the abbreviation while handling with the prescription with the abbreviation. Pharmacists should be careful about that. For example, SSKI is denoted as saturated solution of potassium iodide. Then next one, name of medicine. There are many drug and brand names may be look alike or sound alike. This may cause confusion. For example, indocin and lindocin, digoxin and digoxin, prednisone and prednisolone. All these sets have the similar sound names. Then certain prescriptions have drugs by their generic name. In such cases, pharmacists may be confused about brand of the drug to be dispensed. For example, RX tetracycline hydrochloride 250 mg. In this prescription, brand name is not mentioned. In such case, pharmacists may be confused. Then next one, strength of preparation. Strength of preparation should be mentioned if it is available in various strengths. If it is not mentioned, pharmacist should not assume the strength. He should consult the prescriber and correct it. Then, for example, RX paracetamol 10 tab. Here, strength of the preparation is not mentioned. In such case, pharmacist should be consult the prescriber. Then, fourth one, dose of the drug. Do you know what is the difference between dose and strength? Dose is the amount of drug to be taken at once, and strength of the drug is amount of drug contained per drug, that is amount of drug per drug. For example, 500 mg per tablet. Then for example, we have to take one tablet of 650 mg paracetamol tablet. In that case, one tablet means dose and 650 mg means strength. This is the difference between dose and strength of the medicine or drug. In case of dose of the drug must be specified by the prescriber in the prescription. If there is any doubt in case of dose, a pharmacist should consult back the prescriber and should be clarified. Then in case of any pediatric or geriatric doses, do you know what is pediatric and geriatric doses? Pediatric dose means dose which is provided to infants, and geriatric dose means the dose which is provided to older ones. Okay, so in case of pediatric and geriatric dose, pharmacists should be careful about the dose provided or dose dispensed. Then and also when the drugs are given for when the drugs are dispensed for the pregnant woman, pharmacists should be careful about the dose. And also in case of potent drugs are the drugs which provide larger or higher response at a lower concentration. So in such cases, pharmacists should be careful about the dose. For example, codeine phosphate 0.5 gram. All of the potent drugs are given only in milligram level, so it is the overdose. Okay. Then next we have to discuss about the dosage form of the drug. Most of the medicines are available in more than one dosage form. In such cases, dosage form should be mentioned in the prescription by the prescriber to avoid confusion. For example, there is crocin tablet and there is also crocin syrup. So, the dosage form should be mentioned. Then, next topic is instructions to the patient. Pharmacist has the responsibility to give proper information and direction to the patient about all the information such as quantity of the drug, dose of the drug, and time of administration, route of administration, and if there is any special instruction, all the instructions should be provided by the pharmacist to the patient. Then next one, drug incompatibility. If the prescription contains more than one drug, that is multiple drug prescription, there is a chance for drug-drug interaction or drug-food interaction. It may reduce or nullify the therapeutic action. So, pharmacists should check such interactions or incompatibilities, and should be if there is any incompatibility or interaction, the pharmacist should consult the prescriber and get it corrected. Okay. Then for example, salbutamol sulfate 4 milligram and propranolol 10 milligram. Here there is an antagonistic effect. There are two types of effect, antagonistic effect and synergistic effect. Antagonistic effect means combined effect of two drugs is less than the effect of either drug alone, because the second drug may either diminishes or cancels the effect of the first drug. Okay, so there is a loss of therapeutic action, and the synergistic effect is just opposite to this antagonistic effect, that is combined effect of two drugs is higher than the effect of either drug alone. Okay, in case of salbutamol sulfate and propranolol, there is an antagonistic effect, so that there is loss of therapeutic effect. Okay. Then next one is other errors. Other errors are prescription without date or without signature of physician or physician's register number, or prescription with incorrect patient details, etc. That's all. Thank you.